Hey everybody, welcome to the TIMGA podcast. My name is Mohammed Khalif, and today I'm here with Dr. Wissam Omar. Dr. Omar, welcome to the show. How are you doing? We're really excited to have you on the TIMGA podcast. Thank you so much for coming.
Thank you so much, Dr. Mohammed, for having me here today, and thank you for this opportunity for joining, the podcast. Thank you so much.
Yeah, of course. So, Dr. Omar, I usually ask IMGs, where their journey started, because like all of our journeys are different, right? Everybody has a different journey, and so tell me, like, how, like, when you came into the U.S., like, what was your vision like, and then how did you just get started with everything?
Okay. So, first of all, I just want to thank you so much, Dr. Mohammed, for being behind this great license. And thanks also for Washington Medical Commission for believing on us and make this happen. So I came to, before that, I did my medical school in Sudan. I'm originally from Sudan. I came here to US through diversity lottery visa. So at that time, I thought like my credentials gonna be like valued, and I'm just gonna join the medical like field. And then I learned that no, it's a very long pathway. Um, Other than the steps, we are considered IMGs. Our chances is a little bit less, and being an old grad, this is gonna add also to the hardship of getting to practice medicine. So at that time I was raising my kids, so I start still studying, believing that they're gonna be a chance somewhere. So I work in different healthcare related jobs at that time. I work as medical interpreter and a healthy screener, and I also did a medical assistant certificate and work as a medical assistant for several years. While studying for the steps, and then I learned about the WhatsApp group for a group of doctors who is advocating for us IMGs. You were the leader, at that time, Dr. Khalif. So I joined that WhatsApp group, and we went to Olympia, if you remember, 2019, and just tell them that we are here, we are existing, and we are doctors at home. And then when the bill passed, to be honest with you, Dr. Khalif, I felt like there is really hope. So I kept like having the urge to finish and to clear my steps and all that. It was really a huge, what do I want to say? It's like a very light in the end of the tunnel. So yeah, so I cleared my steps, and then I joined TIMGA, or TIMGA, Telegram group, and you start posting like jobs and opportunities, and I learned about the MTCE license and all that, and I start applying immediately. I get so excited, that there is a way to be able to practice here. Especially why? Because I applied to the residency twice. The first time I get one interview after applying for 100 plus program. Yeah, with no luck
Wow.
at all. Yes. And I didn't end up matching. And then this year I applied to just a small amount of programs. I kind of lost hope. And then the MTCE is here, and the jobs start, posting, and yeah, here I am, practicing under this, like amazing license.
That's amazing. That's amazing. And yeah, it's definitely a long journey. So like I know I speak with different I speak with different IMGs, Dr. Omar. Some IMGs they have the opportunity to study full time, and we know some IMGs they have family support. Were you studying full time, or were you working at the same time? How did you navigate like the steps?
Okay, so at some part, in some point, I was full time, and then I became part time, especially when I work as a medical assistant. Uh, and yeah, so it wasn't easy taking care of kids and the work and doing the steps at the same time. So it took me quite like long time to finish my exams, Dr. Khalif.
Yeah.
So
What advice would you give to like let's say a mother out there who's taking care of kids and preparing for the steps, or somebody who's working full time? What would you give them like advice so they can clear the steps sooner?
okay, so my advice is to be in a group of at least three, not two. Because if you're
Yeah.
in a group of two, you're gonna have like some, it's better to be in a group of three. So you encourage each other, and just keep studying, keep believing that there, you're gonna reach there, and yeah, just time management is very important, Dr. Khalif, and yes.
Yeah, so you got through the steps and and then basically you applied for residency. What was that process like? Because it's not easy financially to apply for a lot of programs, right? So
Mhm.
and before when I used to apply for residency, it was in person. So if you get one interview, then you have to even like spend like maybe $2,000 so just to
Yeah.
get there and come back and just stay there for a couple of days. So it's like it's a lot of money. So how did you prepare yourself um, for being financially ready?
Okay, with the support of my husband, to be honest, Dr. Khalif, I'm very thankful for his support, and he stood beside me all these years, and even during the application time. Um, yeah, it's not easy, but we do have like sometimes you use your credit card and then start paying, so it's heartbreaking when you spend all that money and end up sometimes without any even sorry, or like for applying. But this is the reality, Dr. Khalif, to be honest. Sometimes there is a filter, year of graduation works against us, and being an IMGs as well. But
Yeah.
yeah. Hmm.
Yeah, I understand. So okay, so and it's very challenging. So you get ready, you prepare everything. What was that interview like when you got your first interview with the residency program?
It was nerve wracking,
Yeah,
because on the spot is, um, you know, your year of graduation and what have you been doing all these years. Especially here in US, we can't secure even an observership, Dr. Khalif.
yeah,
It's hard to get an observership of shadowing or an externship. So this was the main problem, I believe, that
yeah,
we have a gap,
yeah,
and I explained that, here in US there is no way, and I'm working as a medical assistant. This is the max I can do, plus
mm,
doing some, like I know other people can do research, but I couldn't find an opportunity for that.
yeah,
Um, but yeah, but it was nerve wracking. They were really nice people, though. It was a family medicine program, I remember, and but yeah, I believe our not being IMGs only, but being out of practice for a while is what
yeah.
worked.
Yeah, no, it's basically it's a knock on all IMGs, right? They programs want you to have U.S. clinical experience, but
Mm-hmm.
then there's no way to get U.S. clinical experience. Even a lot of programs, they don't see externship and shadowing as like real, clinical experience. They want you to be like rounding, talking to patients, so doing some really hands-on stuff that is very advanced, and the same thing that happened to me, Dr. Omar. Like I got a interview at the University of Washington Family Medicine residency program. Like I think it was my second time applying. I was super excited. Like being from Seattle, I was like, wow, UW, and and the program, like later on, I wasn't ranked, and I asked them, hey, what was the issue? And they said, oh, like you were amazing, and but the problem is like we couldn't take a risk on the clinical experience, and that's one of the things that motivated me to advocate for this program, because it's not only like a full pathway, it's a pathway where if somebody does want to go to residency, there's they can get the experience as well.
Yes, 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 Dr. Khalif. It's really hard on us because we did work hard to reach to the E7G certification, and you know, it's like tears and sleepless nights and all that, and navigating the US life as well here as
Yeah.
immigrants and all that. But at least now, the under the MDCE we can practice like full scope as doctors, and I'm so
Yeah.
happy, so glad for that.
Yeah, and it's very successful. Like I've seen a lot of patients, a lot of clinics say, "Oh my goodness, without these doctors, we wouldn't, we would turn down like 4,000 patients a year." And you guys are like really doing a great job. So, Dr. Omar, I know you were able to work with Dr. Sam Shea at We Are Docs, and be able to navigate through Altia. How was the interview process like once you basically you worked with Dr. Sam Shea? How was the interview process with Altia when he first got there?
Okay, so yeah, I'm so also I just want to thank Dr. Sam for being super supportive, and also help me to and connect me with Altia. So after I spoke with Dr. Sam and he knew about my experience and all that, he connected me with Altia in a few days. To be honest, it didn't took long, and then Altia did like a phone screening interview and then an actual interview. The interview went well. They asked about my experience back home and about my steps, and like that. I finished step one, two, and I have an ECFMG certification. And then they explained about the workflow and what to expect. And in less than a week, I got my contract, and I was so happy. Like, oh my gosh,
Wow,
it's happening.
amazing. Yeah, congratulations. That was amazing. So tell me, like, how was your first month like?
Okay. So the first month, I shadowed several providers in different facilities. So we do have like a 2 day online training to know the system. It's
Yeah.
from home, and then you go and shadow like other providers, and know about the workflow, and yeah. So and then you're on your own, but there is a supervising physician who's available all the time, not in person, but through phone, through text and email. They are very responsive, and we can contact them whenever we need any help, any advice, if we are in doubt for like anything. So my supervisor, I met her several times. I'm lucky to have her there. She's so supportive, and also, yeah. And then in the facility I'm working at, there is another provider and nurse practitioner, and on some days PAs. Um, yeah. So um, it went good. It went, it went well. And um, you know um, the patient interaction, maybe because I work as a medical assistant, I didn't find any problem with interacting with patients, because I do know a little bit about, like I've been working for a while. And yeah. So but it's a different setting now, Dr. Khalif. You are the decision maker, you are the doctor, you do rounding and have a patient list and managing, and addressing acute issues and all that. So it
Yeah.
went good. Now I'm in my third month.
Wow, that's congratulations. So are you only rounding in the SNF centers, or are you in the primary care clinics as well?
No, just in SNF centers, but in
Okay,
two
nice.
different ones. Yeah.
Oh, nice, nice. So what would like if somebody's going through going to post acute care right now as a physician, and maybe they have like they're waiting for their license, they have 2 months of time or something like that. What would you recommend they study?
Okay, so I recommend they study chronic diseases and comorbidities because most of the patients we see have like multiple comorbidities, heart failure plus CKD plus like, so even to choose a medication for them, you need to be extra careful if that medication work with their chronic kidney disease and heart failure and all that. So I encourage them to study about chronic and diseases and comorbidities and dementia and all that. Um, so um, the setting in the SNF, Dr. Mohammed, we do have like a short term patients, for example, broken hip, knee replacement, or like people who come to stay for a rehab and then they go home later. And we also have a long-term resident, for example, patient with anoxic brain injury, who going to be there for maybe the whole life, and patient with dementia with chronic wound management. So this type of patient stays for a long time, so we manage and make sure that they are stable, plus any acute symptoms we need to address and treat as well. Um,
Yeah,
yeah. So, and also one advice, I know here in Washington we don't need step three
yeah,
to be able to work, but I encourage all the IMGs to clear the step three. And the reason why is there is no time to study. The work is
yeah,
it's a lot to do, and even when you go back home you have some notes to write, charting, like to documentation is heavy. So yeah, if possible, try to clear step three.
yeah, yeah. Also, like I think step three also it's helpful into helping you get in the flow as well, because I
Mhm.
remember like when I was doing step three, just doing all the orders, moving patients around. It kind of like it's kind of like a real setting.
Yes, yeah, yeah, true.
Yeah, yeah, yeah. So, no, it's exciting to see you guys, really, succeed there. So, what kind of resources are you using for post acute care? Are you using like up to date? Is there like certain books that you would recommend people specifically for post acute care? What do you recommend?
Not any book, Dr. Khalif, to be honest, but up to date and open evidence. Open evidence is a great tool. I believe a lot of residency, like doctors using it, and
Yeah,
it's amazing. It give advices and to the point. So open evidence and up to date is my go-to.
amazing, amazing. Well, that's amazing, Dr. Omar, that you're doing great job there. And like would you say like on your third month right now, like you feel like you know what, I have this down 100%.
Yes, I can say that. I learned the flow, and I learned in the beginning it's overwhelming. Every job in the beginning is overwhelming, and start learning the US healthcare system because it's new to us as well, like but after the first months you feel more confident, you feel like you you got it. And um, still the documentation part is we can see like several patients even back home, it's not a problem. But it's here what is different from back home. Documentation there is just paper and it's brief. Here the documentation is need to be like um, elaborative and in details. So
Yeah,
that's
yeah, yeah. Which is I understand the documentation, but I believe also there's a lot of unnecessary documentation in healthcare. It's just like for billing requirements, right?
You're right. You're right.
Yeah. So it's hopefully like the system changes that it's more value based.
Yes, I hope so.
Yeah. Awesome. Well, any before we sign off, any last words, Dr. Omar?
I just, still want to thank you again, Dr. Kali, for making this happen. Believe me, you did change a lot of IMG's life uh, by being behind this bill and pushing it and still working on it and on all that. So thank you so much. Thank you as well, Dr. Sam, and thank you for, being here for us, all the time.
Yep. Thank you so much. No, you guys are also really important in making it happen. And like marching every day, writing emails, talking to legislatures, and changing the substance. So it takes a entire village to change. So thank you so much for being a part of this journey as well. All right, everybody. Dr. Wessam Omar, post-acute care physician at Altia Healthcare. Thank you again for joining the show, and I hope we can have you next time.
I hope so. Thank you so much, Dr. Muhammad, for this opportunity. Have a good day.
Thank you.